I don't think it's quite as simple as just losing weight. So let me explain. First, I think we have to start with what is insulin resistance? The cells in your body need some source of energy in order to be able to carry out their day-to-day functions. So where do you get that energy from? Well, you get it from the foods you eat. The carbohydrates that you eat convert to glucose. That's the main source of energy for your cells. When you have glucose in your bloodstream, it signals the pancreas beta cells to release a hormone called insulin. Insulin helps your body make use of that glucose and get it into the cells. So what is insulin resistance? Well, that's when the whole process just goes sideways. You've got this circulating glucose in your bloodstream, you've got insulin that's getting released, and it's just not working the way that it should. So you end up over time with higher levels of glucose and high levels of insulin in your bloodstream, and you're not getting the energy that you need. So how do you know if you're insulin resistant? Well, the best way and the only way really to tell is to get some blood work at your medical provider's office. Now, are there other possible signs and symptoms? Yes, there are. You can get possibly some skin tags, extra growths of skin along your neck. You can have a discoloration of the skin in your neck, a little bit darker than normal. You might feel a little more fatigued. You may find that you have some abdominal fat right around your belly button area. You may be more thirsty, you may be more hungry, you may be urinating more. Those may be signs also of you developing diabetes. So, if you're getting any of these signs and symptoms, you definitely should see your medical provider and get some blood work done. Now, what can you do? You can possibly head off diabetes. You could definitely do something to improve your insulin resistance. What are those things? Well, it is to change your diet. And in changing your diet, you probably are going to lose weight. And in changing your diet, you want to reduce the amount of simple carbohydrates that you're eating. You want to reduce the foods that are causing glucose spikes in your bloodstream. And we'll talk more about that as time goes on, about the foods you can eat. And also you want to increase the amount of exercise that you're doing, because exercise is going to help you metabolize that glucose a lot better. So I hope that helps, and I hope that we can help you take the steps you need to help reduce your likelihood of having insulin resistance.